HQA report noted that diseases like hypertension, diabetes, HIV, asthma and depression continue to be prominent illnesses gripping the country. And one of the trends highlighted in the HQA report was the fact that medical aid schemes have substantially improved their communication with members to prevent disease.
Generally, I think schemes and GEMS is not unique to this. They've implemented strategies where we promote screening and preventative benefits, and we've designed our benefits to make sure that there's access.
Since 2021, there's been a significant uptick in breast cancer screening, for example. And this has been attributed to medical aid schemes being more proactive in getting women to be more conscious about their bodily health.
I think it's important, Adam, just for the audience to understand that the rationale for the focus on mammogram screening in the bankmate space was that breast cancer was the highest top costing cancer in our space, together with colorectal cancer as the second highest, and prostate cancer. And ideally, we needed to explore what we can do differently in the wellness space, specifically from an engagement perspective and closing the knowledge gap from a member education perspective, drive early detection of breast cancer and the importance of treatment, specifically in the early stages, to ideally reduce our costs and start saving lives. And therefore, we took the step to analyze the behavioral economics of our female members, specifically 40 years and older, to drive a call to action. And this actually caused for us to look at our communication strategy and be a little bit more smarter to drive behavior change.
A visiting professor from the Netherlands at the virtual presentation was of the view that increasingly people are going to have to be that much more conscious about their lifestyles, as healthcare resources are expected to always be less than the demand for them, suggesting that prevention is better than cure.
That lifestyle interventions will be on the top of the agenda for the coming decade, I think, in the Netherlands, with the obesity, but also with infectious diseases. We had it in COVID time, of course. So, people are good to adapt, and the main message for this coming years is that the capacity, for the first time in our history, the capacity won't be sufficient to treat all patients at all time. And not because of the money, but because of the workforce. The workforce isn't just there. We do not have a skilled workforce to treat them all.
HQA says while this data emanates from the private sector medical schemes, it can also serve to create healthcare frameworks for the public sector, especially as universal access to healthcare is set to improve under the new National Health Insurance System. Nompumelelo Siziba, SABC News, Johannesburg.